Hello, everyone. Today I have the pleasure of interviewing Dr. Pradeep Yadav, an interventional cardiologist. Good evening, Dr.
Good evening,
Pradeep.
Ashina.
I'm interviewing you today because for a school project, and I think you are a wonder because you save lives almost every day.
Thank you. Thank you for your kind words.
Where and when were you born?
So I was born in a small town in north of India. It's called Gurgaon. It's just outside Delhi, which, as you know, is the capital city of India. Right? I was born in 1982.
What inspired you to become a doctor?
Yes. So, my father used to work in a hospital as an accounts officer. And it was always his wish that, look, it's such a noble profession. Doctors are saving lives. It would be really nice that, somebody in our family could be a doctor. So when I was a young kid, I would go with my father to hospitals and just see how patients are being treated. And so very early on in my childhood, I was able to see how doctors were helping these patients in need. And that left a very good impression on me and on my mind. And that's what motivated me just to work towards becoming a physician.
Why did you choose to specialize in cardiology?
So cardiology, as you know, is a specialty that deals with heart disease. And heart disease is the number one life-threatening condition in the world. Whether you're in America, whether you're in India, whether you're in Europe, heart disease is very, very common. And if you don't fix it, this can take people's life. So it's a pretty serious condition. And that's why I really wanted to do something that can make a big impact in people's life, that can really help them live longer and have a better quality of life.
What exactly does an interventional cardiologist do?
Yeah, so that's a great question. So cardiology is a big branch, and there are many different type of cardiologists, right? So we specialize in different things. Some cardiologists specialize in electrical rhythms of the heart. So imagine there is something wrong with the electricity within the heart. Those doctors are called electrophysiologists. Same way, if there is any issue with the blood flow within the heart, then those issues or those problems are fixed by procedures by interventional cardiologists like myself. For example, a patient can have blockages in their heart arteries, and that can cause heart attack. So an interventional cardiologist would go through tiny incisions, either through wrist or through the groin. We can open up the blockages. We can put stents in to open up the blood flow. And similarly, we have valves, heart valves, 4 different types. And with regular beating of the heart, these valves open and close, and they direct blood flow. Because of beating, imagine how many times your heart beats, right? So if the heart beats 50, 60, 70 years, by the time people get old, there is a lot of wear and tear in those valves, and those heart valves go bad. So if you want to fix those valves, that's the job of an interventional cardiologist. So what I do is I go from minimal invasive incisions and go ahead and repair or replace the heart valves. And that way people can feel better and they can live longer.
What do you have to study to become a cardiologist, and how long does it take?
Yes, it's an interesting question. After college, you go to medical school, which is typically 4 years. And after medical school, you choose that do you want to be a surgeon? Do you want to be a physician? And that's called residency. And after residency, you choose your specialty. So you can be, let's say, an endocrinologist, you can be a brain doctor called neurologist, or you can be a cardiologist. So in summary, I would say after medical school, it takes 6 years to be a cardiologist. And if you want to do further specialization like interventional, then you have to do 1 more year. But it's a very interesting year, right? It's not the classroom teaching. You're always working in the hospital. You're taking care of the patients. You're learning on the job. So it doesn't feel like a classroom teaching.
Approximately how many surgeries have you performed?
Oh, that's a tough question. I haven't really counted, but in the last, I think in the last 10 years, I may have done thousands of surgeries. So I typically do around 20 surgeries a week. So every week from Tuesday to Friday, I do about 20 heart surgeries. On Mondays, I see patients in clinic. So I will see about 30 to 35 patients. And then Tuesday to Friday, I just do surgeries all 4 days.
What inspires you every day to do your job?
I think that's a very important question. So imagine you see a family, somebody's grandmother is in the hospital, right? And they come in, they've been short of breath. Every time they try to go take a shower, go walk in the house, they're short of breath. And they find out that their heart valve is bad, right? We can go and fix that valve minimal invasive, right? And that grandmother from that day onwards will no longer be short of breath. So when they see you back in clinic after the surgery, they're so happy that look, I'm no longer, struggling to live. My breathing's better. I have more energy. I can spend time with my family. And they're so thankful that if you had not helped us, we would not be alive, right? So that gratitude that patient expresses every day, that is very, very motivational. It just inspires you to go every day, work harder, and try to help these patients.
What is the best part of your job and what is the most challenging?
The best part of the job is obviously, like I said, to help these patients, right, who are in need. If you save a life, let's say somebody comes in with a heart attack, right? And heart attack is a very dangerous condition where, you block the blood flow to the heart. And if you don't fix that patient, they may die. So it's a pretty big deal, right? So we can go in and we can open up that artery, restore the blood flow, save that patient's life. So when you save that patient's life and you go to the family and tell them, hold their hand and say, look, your father or your grandfather is going to be okay. And you see tears flowing their eye, they're pleasantly surprised and they're happy. I think that's the most rewarding part. The challenging part is that sometimes we see patients a little bit too late. Not all of us have good access to healthcare. Like, not everybody sees doctors, right? People live in remote areas, they live in villages, they live in places where there are not good hospitals. So sometimes we see patients that come in, they're so sick that even in the best of the hands, even in the best of hospitals, we cannot save them. And you wish that, gosh, I wish I had seen you 6 months sooner. It's probably too late. And that sometimes is heartbreaking and challenging, that I wish I would have seen sooner. So the message is that do take care of your health. You should go see a doctor routinely. If you have any symptom, if you have any problem, if you have breathing difficulty, if you have itching, if you cannot play sports, or if you have anything, don't be shy. Just express it to your family member. Just go see a doctor. Maybe we can fix it, right? A lot of times, this is a minor fixes and we can help you. So don't hide your symptoms. We should always seek help if we need to.
Does your job require you to travel often?
Yes, that's so it depends what kind of physician you are. I am involved in a lot of research activities, meaning making new heart valves, and that requires traveling to go to different places to do some experiments. Um, and then in general, most doctors will go to conferences. Conferences are like national conferences. We have it in big cities. And in these conferences, we have world experts coming from different places, and we share ideas. We teach each other, because as you know, teaching doesn't stop in school, right? We can always learn from each other. So in these conferences, we go and share experiences that helps us become a better and better doctor. So that is the travel part. conferences, and some research.
What advice would you give someone who wants to become a doctor when they grow up?
Yeah, that's a good question. I think what I would say is that it may appear that slightly it's a longer track that you have to do, so many years of studies, but time flies, as you know. Once you get in the college, once you get in the medical school, the reward that you get by helping patients is truly better than any other job, in my opinion. And as you get in the as you get in the profession of being a doctor, you enjoy so much that you're like, this is the best thing. Like for me, I don't think I can be any other profession other than doctor. So I would say just stay focused, keep enjoying, think of the reward that you're helping patients, you're helping the community, you're helping your countrymen, and just keep working hard. And it's a great career.
Thank you, Dr. Pradeep, for your valuable time.
Oh, excellent. It was fun talking to you. Thank you.